Welcome to the 10 Tips for Parkinson's Disease Caregivers. Today, Carol McLean, a registered nurse and former Parkinson's disease caregiver, will go over 10 tips for those who are caring for someone with Parkinson's disease. This presentation is sponsored by www.parkinsonsstudy.com and 1-866-565-0249. Today we'll go over 10 tips for Parkinson's disease caregivers, information about a clinical research study for Parkinson's disease-related behavior changes, and the rewards of caregiving. Now we're going to learn a little bit about Carol McLean.
My name is Carol McLean, and I'm a registered nurse and advocate for Parkinson's disease caregivers. As a previous Parkinson's disease caregiver, I understand the many challenges and stress that caregivers and families experience. My husband and I experienced most of the problems associated with the disease during his 17-year battle with Parkinson's. I found the last 3 years of my husband's life especially difficult. It was during this period that he began experiencing Parkinson's disease-related behavior changes like difficulties with reasoning, memory problems, and moodiness. Despite being a registered nurse and having a master's degree in rehabilitation counseling, I was not prepared for the disease-related behavior changes that my husband developed. I also didn't know that 1 in 3 people with Parkinson's disease see, feel, or hear things that are not really there. They may also feel paranoid or distrustful of others, suspecting friends or family of stealing or cheating on them. That's why I am working today to advocate for education and awareness about these behavioral symptoms of Parkinson's disease in order to help caregivers and families throughout their caregiving journey. Now for our top 10 tips for Parkinson's disease caregivers. Let's start the countdown with the number 10 tip. Stay informed and explore research opportunities. It's important for caregivers to stay informed about Parkinson's disease and care options, especially as your loved one may show new symptoms. Stay up to date on news surrounding current research and clinical trials that may be going on in your area. There is actually a clinical trial going on right now in the U.S. and in many other countries for the mental and behavioral symptoms of Parkinson's disease, like seeing, feeling, or hearing things that are not really there, or being paranoid or distrustful of others. It's something that I would have been interested in exploring during my husband's struggles with the same problems. You can visit the website www.parkinsonsstudy.com for more information. Just remember to stay informed and know your care options. It's important to stay informed, and it's also important to seek and accept help from others. Thinking you can do it all by yourself is a thinking error. Say yes when people offer to help. Make a list of things they can do to help you, like babysitting, grocery shopping, or preparing food. If family members don't ask to help, you ask them. Be concrete in stating the help that you need. Do not assign tasks that they are not capable of performing, and just remember that asking for help is not a sign of weakness. It's smart caregiving. Smart caregiving is also about setting realistic priorities and goals. It's unrealistic to think that you can do everything exactly as you did it before. Be realistic about what's the most important goal each day, each week, and each month. Set priorities and stick to them. Your physical health is also very important, as you probably already know. If you don't remain healthy, the person for whom you are caring will be in real trouble. Eat well, exercise, get adequate sleep, take vitamins and other appropriate medications. Seek proper medical care when problems arise. Too often, basic issues are neglected and the consequences can be severe. 25% of nursing home admissions are the result of the caregiver either becoming ill or dying. So make sure that you take care of yourself at the same time you're caring for another. It's also important to take care of your mental health. Anxiety, stress, sadness, and loss are normal reactions to caregiving, and most people who are not caregivers, including family, have no idea what you're experiencing. You could try to keep a journal to write about your feelings to relieve the pressure, or think about seeking professional assistance to talk about your feelings and work through them. Also, don't be ashamed of your feelings, and don't hesitate to seek medical help if you experience feelings of depression. You may experience severe disruption of sleep patterns, appetite changes, inability to experience joy in any activities, or high anxiety levels or panic attacks. Take action and seek medical help if you need it. This is something that many caregivers experience because of the extreme demands of their day-to-day tasks and changes they and their loved ones are going through. Always remember that you are not alone and there are others experiencing similar emotions and difficulties. Find support through national or local groups or even online chat rooms. The American Parkinson's Disease Association, the National Family Caregivers Association, and the National Parkinson's Foundation are all good places to start. They can help you find support groups or networks of caregivers in your area. It's easy for those outside your situation to have clear ideas about how you should do your job as a caregiver. This is usually family. It's important to try to listen to others' suggestions, but their words can still seem like criticism. Try to evaluate whether their ideas might be of value to your situation. It's also important to recognize that they are not the ones doing the caregiving. Try to involve them in the caregiving. Sometimes you just have to listen and go on. If you haven't done so already, it may be necessary to utilize respite care. You can hire someone for several hours a week to provide needed breaks for you, emotionally and physically. For me, going to the grocery store was sometimes like going on a vacation. It was a much-needed break that I greatly appreciated. Try to explore paid nursing, church volunteers, friends, and family for assistance. And for our final tip, try to find some happiness without guilt. It's hard to have fun in the face of tremendous loss and hardship, but it's important to do so. Joy gives you renewal and a strength to manage the stresses associated with caregiving. Keep your mind active and maintain some outside interests. Try to use humor to cope from time to time. Some pretty funny things can happen while taking care of your loved ones. Of course, just remember to laugh with them and not at them. Buy a few of your favorite comedies on video or DVD, or watch a late-night talk show. Guilt is counterproductive, so tell yourself that having some fun will help. It will help you take better care of your loved one. Here are all of the top 10 tips we just went over. Try to review these tips weekly. Maybe keep them in your purse or wallet and review them to keep yourself on track. We also have to remember that despite all the challenges and pains caregivers go through every day, there are also rewards of caregiving. A National Family Caregivers Association study found that caregivers reported positive outcomes of caregiving. 70% found an inner strength they didn't know they had. 36% developed a closer relationship with the person that they helped. And 33% learned proactive skills. It's difficult to find the positives in a challenging job like caregiving, but we should be reminded every day that this is part of a journey and we can grow from this experience.
Thank you for listening to the Top 10 Tips for Parkinson's Caregivers. We hope you found it helpful. For more information about the tips, or to find out about the clinical research study for Parkinson's disease-related behavior changes, please call 1-866-565-0249 or go to the website www.parkinsonsstudy.com.